Okay, today we are going to demonstrate how to insert an NG tube for decompression. So first we would want to check Epic for the orders, whether it be the NG tube for decompression that we'd hook up to suction, or whether it is an NG tube for feeding purposes. And then we would want to assess the patient, checking if they've had any nausea, vomiting, anything like that going on. Check their bowel sounds. You could check for abdominal distension. Make sure they're asking if they're passing gas, things like that. We also want to make sure that they are mentally able to handle the procedure and cooperate accordingly. And then we also want to make sure we come in and explain the procedure to the patient. So, all right, sir, I see that you're here for a bowel obstruction. So what we're going to have to do is we're going to have to insert a tube into your nose. It goes into your stomach, and it pulls out all the contents that are making you not feel very well, causing that nausea and that pressure. So it'll help relieve a lot of that pressure in your belly as well. It's not going to necessarily be comfortable. Just need you to cooperate for me, and we'll get it in as quickly as we can. If you do have a sore throat or anything like that afterwards, then we can give you ice chips possibly, or throat lozenges, chloroseptic spray, something like that to help relieve some of that discomfort you have in your throat. All right, I'm just going to gather all my supplies. I have a basin. I've got a test strip to test the pH. I have a cup of water and a straw. Because sir, when we're inserting this tube, I'm gonna have you use this. We're gonna have you tilt your head forward and drink this while I am putting the tube down your nose. This will help ensure that it goes where it's supposed to go and get it in the right place. I have my pen light, so I can check the nares, check for placement. I have a tape measure. I have a anti-reflux valve. I have my NG tube, as well as a chuck so we can make sure we don't get dirty. I have a safety pin. I have a 60 ml Toomey syringe and my gloves. I also have my stethoscope. And then we would have, for this procedure, we would need suction apparatus. The hospital would hook it up to the wall. And then we also need tubing to hook it up to, which I have right here. Get that off to the side. Stay. We make sure our patient is sitting in high Fowler's position. We want to make sure that they're nice and upright. And then I'm going to, here's my hand sanitizer, wash my hands. My gloves. And the next thing we're going to do is assess the patient's nares and ask them, like, if you ever had a septoplasty, sir, or do you know if you have a deviated septum, any cold symptoms today, anything like that. Have you ever had any facial surgery or facial trauma? Any difficulties breathing, things like that? No? Okay, great. So now I'm just going to take my pen light. I'm going to have you tilt your head backwards, sir. And I'm going to check each nare for any abrasions or any obstructions or anything that looks like it would make it hard to insert. And it looks like both sides look pretty decent. And then we are also going to occlude one nostril and have the patient breathe out the other one, and then do the same thing on the other side. And then whichever nostril they breathe better through is the one that we're gonna go ahead and try to use. with the best airflow. Now, if we were to insert be doing this for a tube feeding, we would need that NG tube is usually about 8 to 12 French, whereas it's usually an 18 French standard for suction. But this is, yeah, for suction. So then we are going to get our tube ready. I'm going to go ahead and connect this here. Anti-reflux valve. And then I'm going to go ahead and put my syringe here so we can aspirate those stomach contents right away. I'm going to get my lube ready and set that in the lube for now. And then we are going to go ahead and measure. So we are going to go from the tip of the nose to the ear. Whoa, and we're gonna fall over. Don't fall back, sir. And then we're going to go down to the xiphoid process. And then it's about 19. And if we go ahead and we measure, losing things, compare that. Down to 19 here. And then it's about at 52. So I'm going to go ahead and I'm going to use a piece of my tape that I have to mark where I have to have the tube. Then I would actually go and set it in my lubricant after we have that all situated. All right, sir. Gonna have you tilt your head slightly forward. First, we're gonna go ahead and use this chucks here to cover you. Make sure we don't get anything on you. Be nice and clean. It's gonna stay. Well, this would be on there to make sure we're not making a mess. All right, sir, if you want to, well, we decided we'll use this nostril. So I'm gonna have you tilt your head forward. And we're going to start to advance the tube. Or no, I need to go back, I apologize. We're gonna tilt your head backwards first. And then we're gonna start to insert the tube here. And then once the tube reaches the throat and they feel it, gosh darn it. Okay, I'm gonna have you tilt your head backwards and I'm gonna start to insert the tube. You're gonna feel some pressure. And then once we get that, start getting that tube to the throat, then we're gonna have you tilt your head forward. And then you're gonna be drinking, drink, 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 as I finish inserting the tube the rest of the way. And that will help with getting that in there all the way. And then we wanna make sure when we get that to where the tape is where it's supposed to be. So, all right, sir, if you are ready, head back. We're gonna start advancing this tube. Nice deep breath, there you go. Good job. All right, drink, 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 drink. Ooh, lost the straw. Head forward. Drink, drink, drink. All right, good job, sir. You did very well. Just gonna take this piece of tape here. Secure it just so that it stays where we want it to stay. Oops. Come on, tape. All right, you did a good job, sir. All right, now that we have it in, we want to check for correct placement. So I'm going to have him open his mouth. I'm going to use my pen light, and I'm going to make sure I can visualize that tube down the back of the throat, which I can. All right, and we're going to take our syringe, and we're going to aspirate a little bit of that stomach content. There we go. And we can quick close that up for right now, just so that we don't have a mess everywhere. And then I would put that in my basin. And then we're going to take our little stick here, and we're going to check the pH of those stomach contents, making sure that they are between 1 and 4.5. And then the other way we can also check for placement is to insert 10 to 30 milliliters of air. So we're gonna take our stethoscope, and we are going to listen into the abdomen as we are injecting that air, and listen for a whooshing sound. Awesome. Sounds like it's right where it's supposed to be. Don't fall over, sir. And then we can go ahead and disconnect that. And then we're going to want to go ahead and hook that up to our suction right away. So we take, where's my little guy at? The thing that we're not supposed to lose. Oh yeah. Seriously? Alright, it apparently rolled onto the floor. I apologize. And unfortunately, if we lose this little guy, we have to open up a whole new kit, and we don't want to have to do that and be wasteful. So here we go. Make sure we don't drop it on the floor either, if we can help it. Hook that to there, and then we're going to go ahead and hook that to our source, and we are going to set our suction. And then after we do that, we can go ahead and make sure that everything is, ooh, my tape, adhered properly, so that we can hopefully prevent having the patient pull that tube out by accident. And so we'd use either our tape that we just made, or we would have a special piece that we could use to adhere that to the face so that it's secure. And then we would take our safety pin, making sure that we have enough slack here, because we don't want any issues with it getting pulled out. So we have to make sure we have enough slack, and safety pin this to their gown. Oh, this is an awful rusty safety pin. An extra one here. Making sure that that's like, so we don't have it pulled out. Another way to check placement for the tubing, making sure it's in the right spot, is to obviously do an X-ray. And that's the best way to confirm. Then we would go and we would do our our charting in Epic, and we would make sure we want to document the drainage, all the COCA of that, the amount, everything. The placement, like where it is placed, is we have it at 52. And then we also want to explain how the patient tolerated the procedure, which nair we used. If there's any issues with either of the nairs, would be good to document as well, just in case it has to be taken out and reinserted. What else? I think that is about it. We'd also want to make sure that we're continuing to assess our patient for any pain or discomfort with the tubing. We're always going to be making sure we're watching that canister to make sure of the COCA of the drainage, especially the amount, making sure that it actually is suctioning, because if it's not and nothing is coming out, then that could mean that the tube is suctioned to the inside of the stomach, and we don't want that to happen either. And we also want to make sure we're always assessing the nairs and everything like that frequently, lubricating them as necessary, because sometimes, especially with the tube in there, they tend to get dry and they can get sore and chapped. But almost right away, the patient should experience some relief, hopefully. You want to document that as well. And I think that is about it. I don't know if I said when we are putting the tube in to make sure that we pass it about 2 to 4 inches with each swallow until it gets to the length. Again, always making sure that patient is drinking as we're advancing the tube. I think that is it. Thank you very much.